awkward silence as people come in, right?
Mm-hmm.
You have to like be waiting room music.
I know, I need to figure that out.
Hey, nice logo. Hmm.
For those that are joining us on the phone and hearing awkward silence, we are waiting for other participants to join us. Thank you for joining us. Please feel free to put your name and organization in the chat so we can see where everybody is from. We have people from all over Maryland here with us today. And we can't see you, we just see your name, so don't worry. Should have some nice jazz music in the background. It's really what we should have. Oh, welcome, Cecil County.
Hey, Ann Bean, how are you?
Mm-hmm.
I know Ann.
My very first supervisor. We're gonna wait for others to join us. We'll get started in just a few minutes. And if you're just joining us, put your name and where you're from in the chat so we can see the vast majority of people where you are, because we can't see you. You can only see us this morning. So welcome. Good morning, Frederick, Maryland. Good morning, Martha. It's so good to, well, I can't see you, but it's good to see your name.
I think it's one of the nicer things of like pandemic webinars that people announce when they're there and like say hi to people. Like it's such a nice touch, right? That this is not something we were probably doing prior to this, but it
No,
becomes one
probably
of those
not.
greetings, hello, because there's no like lobby waiting room, greeting room, you know. So thank you for saying hello this morning, right?
Yeah, thank you for telling us where you're from and joining us. Parole and probation always represents at our speaker series. So thank you for parole and probation. We always see them in our call on our speaker series.
It's like a morning talk show. A big shout out to parole and probation.
It is like a morning talk show that I never wanted to, do a morning talk
I always
show.
wanted one, I think, actually.
Yeah.
Actually, I think I want a late night talk show.
That might be your second career, Adam.
It could be, yeah.
Mm-hmm. Love to see Frederick joining us this morning. I know we have a Phoenix representative, so welcome, Phoenix. It's early there for you. 6 a.m. in Phoenix. So I really thank you for joining us. It's early. Sorry, Nilesh, you know that's early for me. Nilesh's day is like half over by 6. Right?
It's sadly true. Well, it's not over. It's begun. Let's put it.
It's begun, yeah.
Begun.
My day has not begun yet. We're going to give a few more minutes for everybody to join us and get logged on. Sometimes people get a little stuck on our Ring Central platform.
Which is still a Zoom platform. What's frustrating, right, is that, you know, there's a couple of these that are built on the Zoom architecture, but you still have to download their software every time.
You do. It is still Zoom. So it's all the bells and whistles of Zoom, so. All right, we're going to go ahead and get started this morning. Thank you for everyone that has joined us across the state for our speaker series, four out of 5 speaker series, why businesses need to support mental health. And this morning we are in the very beginning of Mental Health Awareness Week, so it's quite apropos. So we're going to just do round robin and do some introductions this morning, and then we'll start out with a presentation by Tonier Cain. I want to thank everybody as our sponsors: Maryland Hospital Association, Asana Consulting, Renee James Healthcare Advisors, Tribridge Partners, Turk House, and Nago Cleaning Systems. Thank you for your support on our speaker series this month. I'm going to go around robin to everyone and say good morning. I'm going to start with Tonier Cain so she can introduce herself, and then you'll hear a lot more about her shortly.
Good morning. I'm Tonier Cain. I'm CEO and founder of Tonier Cain International. I'm founder and president of NIN Cares, which is a nonprofit that provides free services to trauma survivors.
Thank you, Tonier. We're so happy to have you here with us today. I'm going to turn it over to Nilesh.
Good morning.
Good
morning. I'm Nilesh Kalyanaraman. I'm the health officer for Arundel County, and I am an internist by training and had been in community health for over a decade prior. So thank you.
Thanks for joining us. Jeff?
Good morning, everyone. My name is Jeff Richardson. I'm the Vice President and Chief Operating Officer at Sheppard Pratt Hospital, Health System, and Community Services. My role, actually, been a social worker for 35 years and have been in mental health for that long as well. So looking forward to our conversation today.
Adam.
Good morning. Thanks, Tracy. Good morning, everyone. My name is Adam Rosenberg. I'm the Executive Director of Baltimore Child Abuse Center, Baltimore's Children's Advocacy Center, as well as being the Vice President for Violence Intervention and Prevention at Lifebridge Health.
And we absolutely have to welcome Jordan.
Good morning, everybody. I'm Jordan Sosanya, and I'm the Marketing and Business Development at HCAM.
Thank you. So this morning, if you've joined our speaker series before, normally it's a 90-minute panel with questions, Q&A, opportunities for chat, and you will get that. This morning, we're going to kick off our speaker series with a presentation from Tonier Cain. So I am going to turn it over to Tonier, who will provide a presentation on her experiences with mental health and trauma, and for the next about 15 minutes. Thanks, Tonier.
Jordan is loading my presentation. Thank you, Jordan. All right. See, Jordan and I was on here earlier trying to make sure that this didn't go wrong. So let's hope that we still got that going on. So good morning, everyone. Thank you for allowing me to just give you a little bit of a summary of my story. But my story, you know, unfortunately, my story is not unique. It's not. It's very common these days. You know, in order for me to give you you know, overview of everything, I have to take you back to my childhood, where my trauma started, and bring you up to date with where I'm at today and what it took for me to become the healed, successful individual, well, what they call successful anyway, individual I am today. But know that this is my own personal story. This is not a personal attack for anyone in their profession. Just want to say that this is my story and things I created to bring a point together, okay? So, okay, see, I told you. Well, we did it this morning. There it is. A little delayed, but there it is. At age 9, I had created a belief system that I am nothing, I never amount to anything, and this is just how it's going to be for me. See, I knew that some people live in these wonderful houses on a hill and have these families that hug them, love them, and protect them, and some have just lived in an alcoholic, abusive household like mine, and that's where you stay. My mother's an alcoholic. She's always been an alcoholic. And she would leave us in the household 2 and 3 days at a time before coming home, checking on us and feeding us, leaving me as the oldest to kind of take care of my brothers and sisters, to protect them the best way, feed them, try to care for them, because I thought, because I'm the oldest, it was my job. I tried to protect them as best I could. I couldn't always protect them, but I tried. Molestation started very early on for me, around age 9. And I really never understood how a grown man whose body was so big to cover my own child's body would find any pleasure out of hurting me. But again, I had that belief system that I am nothing, I never amount to anything, this is how it's going to be for me. So something else kind of birthed out of that, and that was, maybe bad things just happen to bad people. And if this very, very bad thing is happening to me, that must mean I'm a very, very bad child. So I stuffed it down inside of me, and I didn't talk about it. I didn't tell anybody about it. This is a picture of me around age 9. I remember getting ready for that picture. I remember trying to get the straight ponytail to straight part to get the ponytail, and washing out the red and white connected polyester shirt with a bar ivory soap and brushing my teeth. I brushed my teeth a lot, not because my mother said brush in the morning after every meal or at night, or because she would take us to the dentist. She's never taken us to the dentist. I brushed my teeth a lot because I thought if only I could brush it with the smell of the men. They used to force themselves around my face and my mouth. And so that was the way I tried to deal with that trauma, because no matter what, the smell just did not seem to go away. So I would brush and brush. I didn't know how to take care of myself otherwise. I always smelled like urine. And when I arrived to the schoolhouse, the kids would circle me and call me names. I run to the bathroom, huddle down and cry. The teacher would come and get me out of the bathroom, take me to class, set me down, and start the day's lesson, but never ask why. I also started drinking around age 9, around when the molestation started, because when there's nothing else in the household, there's alcohol. And so I used to wander into the living room after those last night's party, and I would find these half-filled cups sitting around, and I would drink them. What I realized after a certain time, when I drank when my get these half-felt cups. When my mother smacked me down and called me names, it didn't feel as bad anymore. And when the men came, it didn't feel as shameful, as painful. So I started to seek out these half-filled cups. But around age 11, somebody made a complaint against my mother to the Department of Social Services, and they sent out a social worker to follow up on this complaint. And when she seen the filter conditions we were living in, she immediately removed us from the household. And as you good folks know, there's not one family sitting around waiting to foster so many kids together. So here we got another layer of trauma, because now I'm being separated from my sisters and brothers, and yes, even from my mother, you know, and because there was they didn't put into place something to help me to transition. The only thing the social worker could seem to say was, don't cry, it's going to be okay. What's going to be okay? I knew nothing. I was 11 years old, terrified. And then I was being separated from the only love that I had, was to give and receive love from my sisters and brother. So it was placed into foster care, and fortunately I was only there for a short period of time. Different family members chose each and every one of us. My older cousin chose me. She had 3 daughters around my age. For the first time in my life, I felt a little safe because nobody was touching me or teasing me. And I was doing well in school. I was doing so well in school that I end up trying out for the school play. And this is me. And I promise you, there's more Black people in Annapolis than me. Kind of sort of. This is when I and it was amazing for me. After school, I was able to become another drama club, and they gave me a partner for around 3 years. Around age 14, my mother came back to my cousin's house and told me she wanted me to come back and live with her. And she said she loved me. And up until that point in my life, I could not remember my mother ever telling me she loved me. So I didn't hesitate. Off into the sunset, I went with my mother. Well, by then she had 3 more kids. Social services had given her even more benefits in another public housing apartment. But I realized nothing changed. And I attempted suicide. And I took a whole bottle of pills. And when I woke up in the emergency room, nobody asked me why. They talked to my mother and they released me back into her care. And she sent me to live with my aunt, who did the very best she could. But by age 15, I was an alcoholic. But it still gave my mother some control of my life. So when this man was well into his 20s, I was still a young teenager, wanted to make me his wife. And he befriended my mother by giving her all the alcohol she could possibly drink, so she could sign the marriage license on my behalf so I could marry him. And I married him. And she moved in with my 3 little sisters. I'm like, okay, maybe my mother be proud of me now, because I'm still trying to seek her love, right? And maybe this older man can protect me from all the other bad men of the world. But this knight in shining armor, there were times he would call him from work and he would stump me in my stomach, in my chest, in my head, until he seen blood. And so then when he was finished with me, he left me. So around age 19, and when he left, he took our son, my only son at the time. When he left, he took him as a form of punishment and sent them out of state. So at age 19, when somebody said, try this, it was crack cocaine. It was the answer to all of my problems. You know, that just having that smell that I couldn't get away. When I did this drug, that smell went away. You know, and I found a way for me to really be able to heal. That's what I was thinking. I'm healing because I'm not feeling. I'm healing because I'm not feeling, but I wasn't healing. I just wasn't feeling. I was able to use this drug, and actually the drug, it stopped me from blowing my brains out. So I ended up in the streets for 19 years, eating out of a trash can, prostituting, trying to, just to stay in somebody's house sometimes. I just had to give up my body or do something sexual, to lay on somebody's sofa, just anywhere as I could go. I couldn't even go in anybody's house otherwise to use the bathroom. And for almost 20 years, I lived in the streets. And as a result of that, everybody that looked at me, the only thing they could seem to see was, as they called me, a dirty crackhead prostitute. But then they kept diagnosing me mentally ill. They kept saying that and I never really understood that, because every time I would check myself into that 72-hour voluntary mental health facility, at our county hospital, it depended upon what day of the week it was. If it was a Wednesday, I was schizophrenic. A Monday, I was bipolar. They would always give me a different diagnosis, but it was always the same psychiatrist. Never got that. But I would always ask them, how do you know? I would tell them that I had been up for 7 days straight smoking crack cocaine. See, they never allowed the street narcotics to get out my system before they truly gave me assessment or evaluation. But I didn't have no insurance, so I guess there you have it. As a result of being angry and out of control, as they call it, it was just really me coping with my trauma, the only way I knew how to cope. I was always put into seclusion and restraints. And I know I don't have to tell you, one of the worst things you could do to somebody that's a victim of neglect and abandonment is put them in a room, shut the door, and walk away. Because my issues with my mother was always triggered. Nobody was helping me to identify, address, or treat my trauma. So I did the only thing I knew how to do, and that was to tap into my survival mode. And my survival mode has always told me to fight. So everywhere as I was going, I was getting more and more layers. See, now I'm in the systems of care, and I'm thinking that maybe somebody, I can feel safe. Maybe somebody will believe me. Maybe somebody will ask what happened to me. But instead, I was getting more. My first court-ordered drug program, I was raped by a drug counselor. Everywhere as I was going, people was hurting me. So, I mean, where do you go from that? And then when a psychiatrist would see me at the detention center, I don't know who's changing my presentation, at the detention center, he would see me for every bit of 10 minutes, just enough time to increase my medication. For bipolar disorder, they would give me Thorazine, Ativan, and lithium at the same time. So I wasn't given a real opportunity to heal, and to be successful in it. Not intentionally, I know, but because we don't understand the impact of trauma, oftentimes we can cause more harm if we don't really truly understand. My children, I was conceiving children as a result of rapes or prostitution while I was on the streets for almost 20 years, and they were rightfully so taken away from me. But even then, even Department of Social Services, when I would try to go visit my children, they wouldn't let me visit my children, or when they did, they let me see them behind a one-way mirror where I could see them playing with their new mother who was going to adopt them. And I wasn't able to see them. And I would leave the Department of Social Services, and the social worker would stick like a picture in my hand, like this picture here of my children. And she would say things like, "This is a closed adoption. Do not contact us again. Do not contact us again." So where do you go from there? I went deeper in the streets. Deeper in the streets, again, unable to go in anybody's house, being told and treated not by community members or family members, but by public health systems. Those that provided services treated me and as if there was just absolutely no hope. As a result of that, I ended up with 83 arrests and 66 convictions. And just living on the streets, trying to survive the best way I can, trying to survive the trauma that I was experiencing. Not only did I have to remember the old trauma, but the layers of trauma that I was being given daily. And I've been beat and raped so many times living on the streets, I stopped counting them. Most times, not all every time, but most times in the system of care, I was being re-traumatized. But I put this one in, this picture right here, and because for 19 years living on the streets, with crack cocaine, I had really nice teeth, because I still brush my teeth I just was always trying to get that smell away. Well, 16 years ago, I was in prison again, pregnant with my daughter, and I was terrified I was about to lose another baby, and I did the only thing I knew. The only thing left to do at that point, I laid on the concrete floor in my prison cell and I cried out to God to help me. And I cried for hours. I was like, "God, I don't know if you listen to people like me, but if you do, please help me. Don't let them take this baby," because I knew this. I was going to be successful in suicide this time if I was going to have another baby snatched from my arms. And I was able to go to a program to help me to treat my trauma. Everybody was trauma informed. Everybody knew how to help me with my triggers. They were helping me to identify, address, and treat my trauma. It was a one-stop shop. I didn't have to leave there to go see my parole and probation officer. I didn't have to, where I got I got re-traumatized sitting in a, sitting in a waiting room or whatever. And everywhere as I went, I had somebody with me. And I remember them taking pictures of me and my daughter. And it just was a program that not only addressed and treated my trauma, but because it was for pregnant inmates, it helped me to form a secure attachment with my daughter. And I remember them coming and taking pictures all the time. And I never really understood until I graduated the program. And they would show me the pictures that they took over time. And this is a picture of me and my daughter while I was still in the program. And I knew then that things changed for me. So I was able to form a secure attachment with my daughter, and I had us evaluated up to 2 years of age. The University of Maryland evaluated us until she was 2 years old to make sure that I continued that secure attachment. 16 years ago, I cried out to God to help me, and I was able to go to a trauma program to treat my trauma so I can replace the old tools of using drugs and alcohol with healthier tools. And I had never had another desire to use drugs, alcohol again. It's been over 16 years. I'm no longer on psychotropics because I was being misdiagnosed because of the behaviors. Misdiagnosed because they did not understand the impact of trauma. They looked at my behaviors as symptoms of a mental health diagnosis, which was wrong. And today, quickly I go through this. So I needed somebody up in my business, help me to learn how to create a budget and do all the things that homeowners are supposed to do when I moved into my first apartment with my daughter, because they did not just assume. Most times people just like to assume because we're an adult that we know how to take care, be responsible and bill paying and taking care of our household. No. Before I got to the program, I was in prison. Before then, I was 19 years on the streets. Before then, I was married to a older man. I didn't have a job. I wasn't paying bills. And before then, I was with a irresponsible parent that didn't pay bills. We got evicted. Where would I learn that? And they understood that. Finally, somebody understood that and helped me to be a homemaker. And because of that, within 18 months of leaving prison, I built my own home. I had a home built for me. Today, I own 6 companies. I own 6 companies today. And everything I do is like giving back to other people. I own TCI, which is a training and consultation company. I own TCI Publishing House. I'm a publisher. We publish books. Needs Care is my nonprofit that provides services. We actually opening up 2 trauma houses in Baltimore. We have offices in Maryland as well to provide free services for trauma survivors. And we take them all the way to home ownership. And we have a lifetime commitment to them because trauma is a lifetime event. It's not something that just because you heal, you don't forget, and people need lifetime support. So we give them, we call it life support. We give them life support in this. We don't just say, here you go, good luck. I'm also founder and co-CEO of Sisters Love Home Healthcare Services. I am an award-winning film producer, and I'm producing a TV show now, and I have 3 films that is in post-production as well. That's my my production company that I own. I also own Voices of Trauma Speakers Bureau. We put people on the circuit to tell their stories. I've trained in every state in our country, including Alaska and Hawaii, and my work is known all around the world in different countries. And I am an author. Just got to end some. This is me in South Dakota, where there isn't any Black people. I go back to work with South Dakota Supreme Court, and every year I would go in and we would do, just do some training and stuff like that. And they would always call me in December, which is cruel in itself. My daughter actually won an award. She won an award for a contest called Letters About Literature, Humanities contest sponsored by the Books in Congress. She came in 2nd place in the state of Maryland with 1,800 submissions. This is me and my husband, which is one of the most difficult relationships I've ever been in. And it's horrible to be married sometimes when you're a trauma survivor. And that's a whole different presentation. So what if at age 9 somebody recognized my trauma and I was giving the proper trauma treatment? Everybody in the organization was trained on trauma, knew how to engage with me as a trauma survivor. Isn't it possible that this child, come on, this is really delayed. This child could become this woman without all the other trauma in between. This is me. I did a presentation in Georgia, the country Georgia, right above Turkey on the Black Sea, to help access criminal legal aid in the criminal justice system for the world. There's 60 dignitaries from around the world. My children are restored in my life, which has been amazing and scary and a lot of anger and resentment, but working through it. My youngest son giving me my wedding. All right. So one more question. If this woman was yet again in your facility, in your program or whatever, 83 arrests, 66 conviction, 19 years of drug addiction, longer alcoholism, lost all her kids, being diagnosed mentally ill. My question to you is this: would you be able to look across your desk at this woman right there and have your charts and your record of her history in your face? Would you be able to look at her and imagine her today? Do we truly believe in the people that we serve? I can tell you, you don't believe in them. How can you expect them to? We don't have the right to deem somebody hopeless. Please don't give yourself that right. That is not your right. This is my belief. Nobody can ever change my mind. We are created in the image of the Almighty God. We are worth saving. So I say this in closing. When I started to feel safe, I started to heal. When I started to heal, I felt empowered. I had the chance to see my strength, not so much my weaknesses. I felt worthwhile. When I could see my progress, I was motivated to continue this journey as a mother, a wife, a business owner, as the survivor, and let me add this, and as a child, a grateful, grateful child of God. So, where there's breath, there's hope. Never give up. Thank you.
Wow, Tonier, I've heard your presentation multiple times, and I always just have to pause afterwards. And like you said, when there's breath, there's hope. To take a deep breath and pause. And you know, always in the fact that we met 16 years ago, and how amazing that opportunity was for you and I to meet in a different space. And to see you with your daughter then, and to see you now, and how beautiful that evolution is. I can only thank you. And for all the chats that are coming in, and you'll read them when you take a pause of the evolution and your story. So thank you for sharing it here today. It always bothers me too that the program that you were court ordered to attend, Tamar's Children, was all about circle of security and was defunded, and how we went to the courts to actually advocate for more funding. Do you have any thoughts on that related to the actual program that you went through and how it no longer exists within Baltimore?
And it was so very sad, because who got caught up in all of that was the women that were still in the program. I was actually working for the program at that time. I was given a job. They was like, okay, well, since you're here, because I was volunteering there, and they gave me a job. Andy Crofton, Dr. Andy Crofton, who was my mentor. So it's so sad, because it was so much tug of war between the substance abuse and trauma piece and state for funding. And I just think that the women, yet again, it became political, or, it became, it's just this whole, it was everything except about the women, that result of that. And it was devastating.
It was devastating for me as well. Tamar's Children was one of my programs that I worked with when I worked with pregnant women and children 16 years ago. So it was devastating as well. But I do want to transition now. If there's any Q&A for Tonier, please put them in. There's some comments, certainly, of course, and we love the comments to hear those. So we're going to transition over to the panel, but we absolutely need to address, and Tonier put us all in our place earlier this last week when we jumped right into mental health. And so, you know, the first question is to her about truly needing to address the healers and making sure that we are recognizing any of those working in the space of trauma and mental health. So can you speak to healing the healers, Tonier? Because that's important, and we don't
panel, because this is about a panel discussion. But, so one of the things that I said was, you know, we often keep talking about being trauma informed, and we like to skip over the fact that we need to take care of those that's going to take care of the trauma survivors, and recognize the trauma survivors that's actually working in our facilities, in our program, and take care of them. Because what happens more often than it should, a lot of those that are providing the services, because they haven't given a good training, the healers training, to make sure that they're able to recognize their own trauma, and it's so they can learn ways to self-soothe or self-regulate. Sometimes they even mean passing it over to someone else, so they won't do more harm to the people that they're serving, and causing harm to themselves without, you know, being able to self-soothe, self-regulate. So before we start talking about being trauma informed, we must make sure that we take care, you know, get the speck out of our eye, the log out of our eye, before we go around thinking we can help somebody else, and get our stuff in order, you know, in our backyard.
Any other comments on that from the panel?
Yeah, this is Jeff. I mean, I have to say that particularly now during this pandemic, we are asking a lot of the people who are taking care of others throughout healthcare, throughout all the services that Tonier talked about. And I think this is one of the things that I know we're going to be talking a lot today about, how to support businesses, but the core of any business is their employees, and the ability to restore people's ability to do this great work is critical. And I think people have lives outside of their jobs, as well as the trauma and pressures and strains that they're dealing with helping others. And so a lot of the work that we do is helping people both at home and at work, but it's critical now more than ever. I mean, there was a study that was just done by the CDC that said nearly 40% of Americans, adult Americans right now, are struggling with some form of mental disorder. And these numbers are staggering and are growing, and the people who are caring for others have to carry this around, as well as take care of each other. So hopefully we can talk about some specific techniques to do that.
Well, and I think what you talk about, Jeff, really lends to what we see, not just in the workplace, but throughout society, is that childhood trauma is unfortunately too frequent and too common. And I think, and Tonier, thank you for sharing your story and your personal journey there. And I think you hit it right on the head very early on, that you're not alone in this, and your story is not necessarily unique, unfortunately, and that there are far too many children who have grown up and had not just traumatic childhoods, but grew into traumatic adults there. And what we know from a body of work called the Adverse Childhood Experiences Study, the ACE study, and by all means, Google ACE study, when you're done with this, talks about that there are unfortunately 10 common adverse childhood experiences that occurred to kids. 5 of them are abuse and neglect related, and 5 of them are household dysfunction related. Living with mental illness, living with someone who has a substance abuse problem, living with domestic violence, being a victim of sexual abuse, being a victim of physical abuse. And they occur to 60% of Americans have at least one adverse childhood experience. And as you have one ACE, unfortunately, the number of ACEs compound and increase there. And so while 2/3 of adults have one ACE, approximately a quarter of all adults, 23% of all adults, report having 3 or more ACEs there. And so, as Tonier, explained in her story, and all too common in these journeys, is that there are many people growing up with multiple polyvictimizations there, which then compounds upon them for the rest of their lives. And I think that these are complex traumas that we find in our neighborhoods, our communities, our workplaces, that we need to do the best we can to be able to address it, to help, and to help these survivors overcome that. And you can overcome it at any point in your life, but yeah, it's quite significant there. And I think that the commonality of this is far too prevalent, that we're going to only see compounded upon the fact that now we're living at this moment in a pandemic. So it just makes it even worse there.
Absolutely. And I was in a training several years ago, and we talked about the iceberg, right? And so you only see the very smallest part of the iceberg sticking out of the water, and everything below it you don't really see, right? And so those are your childhood trauma, your experiences. It didn't even talk about structural racism, and that's not even the topic for today, so we won't go there. And so all of those experiences is what makes a person who they are, and people can't see those traumas, right? And so as we transition to start talking to the business community, or people that are working, regardless of what type of employers you have within your business, what are we seeing in the business community related to mental health and trauma? What are we starting to see now as we sit in the middle of a pandemic? So Jeff, I don't know if you want to.
Sure. I think that it's, as I was saying a minute ago, we all have families. We all have struggles beyond the doors of our jobs. Things don't change when you show up to work. You've heard, Adam's point about adverse childhood experiences and the impact. That's something people live with all the time. But what we're seeing manifest in work is even things that don't really seem so obvious. This panel, we were all talking about how many Zoom calls we're on and how much of the demand that our work lives and our home lives intersect. And so there's what we're seeing and we're hearing from a lot of employers are, the things that I mentioned earlier. We're seeing an increase struggle with anxiety and stress disorders. We're seeing addiction and alcoholism increase, suicide and suicidality being incredibly problematic. Families that generally don't spend all of their days together are literally sitting with laptops next to each other, trying to teach their kids, deal with ensuring that they can maintain their job and maintain that work-life boundaries, which have become incredibly diffuse and spread out and confusing for people. And we're in an environment where the leadership of the direction of the country around these issues further compounds all the anxiety people are living with. So we have a challenging environment if everything goes right. And as an employer, you're asking people to continue to be focused on their job and their employment. It requires a lot of support to employers, and as employees, or excuse me, as managers, leaders in your organizations, there's a lot we can do to help people.
Well, I think, Jeff, to that end, then, what, any of us can jump in on that one, but, what can we do to help people? What is it how do we become trauma-informed workplaces, and how do we make these conversations, more, it doesn't have to be you, Jeff, who answers, but yeah, to make this more welcoming and more supportive. So when that person doesn't have to necessarily go in and say, hey boss, I've got these traumas in my life, my kids have these traumas in their life, what can we do to begin to open that gate?
And I think
please, Nilesh, go ahead.
Yeah, to tie it back to something that Tonier was saying about the need to feel safe. That's really critical for people who've experienced trauma, but we're also seeing that during COVID manifest in a different way, for a different reason, but that need to feel safe, which is very understandable, right? It's one of our core needs. And so what does that look like? When we say in the workspace, our workspace has expanded during COVID to now include our homes, and that adds to different strains and stresses as well. And I'm looking forward to talking about some steps that we can take and that businesses can take to really think about these issues and also provide support as well.
Yeah, Jeff, do you have some tactics that businesses can even to think about in implementing mental health services within their workplace?
There's a lot, but I mean, let's first start with the reality is that unfortunately, with all of healthcare, generally the benefits for mental health services and supports aren't where it should be, meaning we need to invest more in our employees around mental health issues. But there's some training and there's some trainings that have sort of national recognition that have been extremely helpful. Mental health first aid, and we can talk more about that later, which is trained nearly 2 million people in this country on sort of what to do if you're a layman, if you see someone struggling, what to do and how to seek help for someone who's struggling. I think a lot of times that we all see it is that we know people who are struggling, and you know, Tonier, to your point earlier, not everyone has a mental illness, but we need to ask, we need to check with people on what they need and how we can help them. The second is for businesses to really start thinking through the fact that investment in their employees around their own mental health pays off. There was a study done 2 years ago from the World Health Organization that said for every dollar invested is a $4 return in this, and not for the goodwill and the wonderful things about helping people live a better life, but make people more productive employees. And so, but I think it's helping people understand how to ask the questions. It's providing the supports to the employer to be able to intervene when they need to, and to be able to support people through this. I think the other thing is, you know, tactically speaking, the demands, all of our worlds have been thrown upside down in the past 6 months, right? The boundaries between work and play and school, and recognizing that. And there's a lot of sort of basic techniques around giving people more breaks, asking people what's going on. Zoom is a remarkable tool, or whatever, Teams, whatever you use, but it is not a replacement for checking in with your staff, asking how they're doing, and making sure that people get the help and support that they need. But some of it comes down to, you know, the enormous weight that everyone is carrying through that compounds what we were talking about earlier. Adverse childhood experiences have been there for people, and this pandemic has made it worse. Isolation has made it worse. So anything you can do to support your employees through all of those things, and I'm sure our other panelists have other comments on that.
I actually do. So I want to give an example. Very early on, and I'm not going to apologize for being real and raw. I'm not, but I'm going to use this specific. Jeff, let me ask you something. How long have you been at Sheppard Pratt?
I've worked in the community side of Sheppard Pratt for about 30 years.
Okay, so let me tell you my experience with Sheppard Pratt. Okay, and I'm just going to use my experience of talking about, and I know this is way before Sheppard Pratt was really moved into the trauma-informed care way. So way back then, there was something that was going on between Maryland Disability Law Center and Sheppard Pratt. They was going through this settlement. And as a condition of it, they had to hire a peer specialist. And because Laura Cain, who was my best friend, decided that she would throw my name out there, you should really contact Tonier Cain to come in and be a peer specialist. And I'm like, first of all, Laura, you should talk to me first. But, you know, so they did. They contacted me and said, hey, Laura, you know, Laura contacted me. So they called me in for an interview. And I went for the first interview. And it seemed to go well, you know, and it wasn't, you know, I didn't, you know, but it was I had to see 4 different people for a peer specialist position that I was recommended by the very organization that was trying to settle with them. And it got to the point where by the time they decided to offer me a job, I'm like, I'm not trying to be the COO. I just want to come and help people. Oh, they asked me about my history, you know, and all of this. And what about this charge? I'm like, I'm a peer. That's, expect that. But so I end up saying, absolutely not. I would not work for an organization like that, because if this is how they treating me, I can imagine this is not how they treating the people that they provide services for. So, and it's just one of those things where when we start to talk about employees, even coming in the door, we need to set a tone. Even the way we treat them, even in interviews, and we need to set a tone of who we are and what we, and like I said, again, this is before I know you guys took on the trauma-informed. So let me say that, you know what I mean? I know you guys have done tremendous work becoming trauma-informed since then. These were many years ago when I first started my process. So, but it's just a really good example, just coming in the door and setting the tone.
I think that's a perfect example. I think one of the things that when we start working with employees, there are better ways that we can help onboard people and make sure that we can connect regardless of the business. So I'm sorry your experience wasn't good back then. Come back now. I'm here for you.
I don't know if
But you know, and in no way to make.
You can afford me now, Jeff.
But look, in no way to make excuse for Jeff, but I think the entire field wasn't trauma informed. That we've been doing trauma work for 20 years, 30 years as a field, and we were never necessarily trauma informed ourselves. That we were basically, like a blunt force sledgehammer, sort of, dealing with these issues and the situations there, and rarely were we looking inward to take care of ourselves or to ask our staff, how this work impacts them. And it's really only been over the last decade that I think we've started to take, a significant time to invest in our own staff. And I think by nature of this work, the field attracts people who have been impacted by trauma. And these are people who've been impacted by trauma who want to give back, and yet we're sometimes doing them damage by not necessarily having that soft landing or that safe space for them to be able to process what they've seen. When you hear traumatic case after traumatic case after traumatic case, 5 days a week, 365 days a year, you're gonna experience some level of trauma. And if you come from a baseline of trauma to begin with there, it's only going to compound it. And I think we talk about what businesses can do. I think sometimes we have to think about what we should be doing even in the trauma field to be trauma informed, because it goes back to, I think, Tracy's initial question: how do you care for the caregivers? And if we're spent by the time that we hear your story, then we're no good. And so I think it's a real thing that we need to take heed of that, as well as any other corporation listening to this, is how do we become a little bit more trauma informed.
But Adam, can we also agree this is where I think people don't want to agree on. I see you, Jeff. I see you smile and say, "Oh, she warned us." But can we just agree on this? Some people are not a good fit to be in a trauma-informed organization.
Oh, absolutely.
Their mindset won't change. They don't believe people can change.
Well, I think both ways, Tonier. I think there are some people who are not set to work for a trauma-informed organization. I think there's some organizations that aren't right for that trauma, that victim of trauma. And I think there are some victims or survivors who may not be at the right place in their journey to necessarily work for that organization. So even if they feel it here and they have the mental acumen here, they may not be at that right place, or the organization may not be at that right place. And I think it really does have to be that right fit, because we could do damage. You're absolutely right about that it just may not be right. And you can't fit that square peg in that round hole if the fit's not right, particularly if you have a trauma background. I'm not suggesting in any way that we're using trauma as a screening tool to prevent someone from working there, nor is it necessarily our responsibility to be so parental to say, this isn't the right place for you. But I think that it does have to have that meeting of the minds to make sure that that you're going to be okay here.
But I do think. Yep, and I think you both bring up a very valid point that businesses need to start looking at their practices of hiring. I think that's really super important, and in how they're addressing people, how they're welcoming new people in, how they're interviewing, how traumatic that could be if you are a woman and you have 4 men sitting across from you, and even how they're physically spaced, right? And so these days everything's Zoom, but little less intimidating. But walking into an interview and you are on one side of the table, you have 4 men sitting across from you, and how intimidating that can be. So thinking about those, what could be very small pieces of your process within your business and how it can shift, right? Even placement within the room. I do want to get to a question that came up, and I think Reverend Tillman probably has logged off, sadly. I know he had to go, but I want to ask the question. A coalition of citizens are meeting with the police in Harford County, and the police admit that they do not handle trauma in their department well. And I don't want to go down the police reform rabbit hole, so that's not what this is, but how can the panel help law enforcement to deal with trauma ongoing, like Tonier said so well?
So I'm going to jump in for a second here. So in Arundel County, we have what I think is a really good, strong, successful model of integrating mental health and crisis work actually into our police force, into the Anne Arundel County Police Force. Our crisis response, which is done in partnership with the police, just won an international award just this summer, actually, in recognition of that. And that I think that meeting is happening is a good sign, right? It's not enough, but it's certainly a necessary step. And it's looking at how you're training officers, not, and this is like a change management issue, but from day one, right? What is your approach to supporting officers who are experiencing trauma and who think about their safety as well? And you're right, Tracy, we can go down a large rabbit hole as to what that, but I think we have to just acknowledge that that's their concern and that's the community's concern as well, which is safety. And so how do we look at that as a collaborative process, right? And so that involves bringing in that mental health training, understanding what it means, not just for policing in terms of doing your job in the community, but what that means for the officers themselves as well and how they deal with what they're seeing. And Adam mentioned this, is that for caregivers, for healthcare workers who are seeing trauma continuously, that has to be considered as to how that impacts the individual. And you have to take that into account with the police, is what is the effect on officers of seeing what they see every single day, as a piece of that equation.
By way of maybe shameless self-plug, but the child advocacy centers, which really every county has a child advocacy center, is also a great way to partner that. It's work that these programs have been doing for a long time, and understand and appreciate that trauma, even though it's child focused, there's the root of the child advocacy center there. A lot of those lessons can be useful, and I think that finding ways, especially in Harford County, is connecting with Sheriff, Vito Menzel runs the Harford County Child Advocacy Center, and just using them as a cohort to be that learning practice, to be a little more trauma informed, and to find ways to create that resiliency practice there for law enforcement. One of the things that we had done, at our shop at Baltimore Child Abuse Centers, we had a grant to be able to bring in an outside therapist for our staff and our teams, not just us, but the police as well, so that they had an external person to talk to in a safe environment. I think one of the challenges of law enforcement all too often is the fact that they are reluctant to show that weakness and that burnout, because they fear, and sometimes it actually happens, prevents their advancement there. And so the system's doing more harm than good by offering help, because they want to eschew that help, for fear that it shows that they're weak. And by being able to have some level of an external therapist, counselor, to be able to let people dump and unload, is really something to think about and invest in. For any organization.
And I think that's at all businesses, Adam, right? Like we can go down in the police conversation, but that's really at all businesses. I mean, that's a tactic that we want to make sure that businesses have access to EAP services. And again, healing the healers. HCAM is 220, 250 staff of community health workers, care coordinators, nurses, and social workers who are working with some of the most vulnerable individuals. And I know that they are working much harder these days than they ever have before. even though a lot of our work was, you know, beating the streets and out in the community and knocking on doors. They are so busy, and I constantly say to my team, make sure staff are taking days off, make sure staff are contacting EAP services if they need it. And we don't have those water cooler conversations, right? Because we're not in the office. And so we see people on Zoom and they look great, and, you know, there's chaos going on behind them, behind the door that you just don't see or hear because they're not sharing it. So one of the conversations is around a hybrid model, right? So some of us are back in the office and some of us are teleworking. And so there's a mix of that. And, you know, there was a comment earlier also about having a safe space. And so I want to talk about how can we support our employers when we're looking at, you know, what are we looking for related to burnout and, you know, mental health triggers within the workspace, because people are hiding behind their Zoom cameras and turning them off, and then some are in the office, because there's kind of that mixed hybrid.
I think it goes back to some of the earlier conversations the panel brought up, but even the conversation you just brought up, Tracy, which is that we don't necessarily equip our police or our employees, our HR staff, other people with tools to identify what to do when someone is struggling. And so, you know, I think there are things that you can see that are obvious. If someone's simply losing interest, not being able to pay attention, you know, absenteeism, but there's a whole other category of work, which is the presenteeism. People who are showing up but aren't really there, right? So they're not able to focus, they're distracted, they're not able to get their work done. And clearly those are some of the things that we're seeing more and more now. I only speak for myself in that, you know, I have a child with special needs, lots of demands. My work is a high stress environment. All of this piles up on you every once in a while. And, you know, if you're not aware of your own impact, it can be enormous. But I do think things like mental health first aid or training and basic training about what to do with an EAP or other tools are critical. And it depends on how committed an employer is to investing in their employees. Granted that, you know, we have about 5,000 employees, and it's a continuous challenge because we have people working everywhere 24/7, 365 days a year that are critically, their needs are critical to them being able to do the great work that we try and do every day, but it is exhaustive. So being able to have EAP tools, training supervisors on what to identify, and looking for big differences in behavior that people present. But again, Zoom itself, we were even joking before you all got on, you know, I got a suit and tie on, but I could be walking around in my bare feet. We don't see the full dimension of what people present all the time. We usually try and give our best points.
You know, Jeff, just to follow up with that, you know, we mentioned mental health first aid once or twice. Would you mind just, you know, quickly summarizing what it is? Because it's not just something for trauma professionals, you know, in organizations like ours. Any organization can be doing mental health first aid. And just as, you know, we're going to run through active shooter drills or, you know, tell people how to do CPR. Mental health first aid is a training and a tool that any organization can employ. You want to just, you know, give a 90-second summary as to what it is, and I threw the link in the chat.
But you know, I think the bottom line is it trains people on very specific ways to ask the questions. And Tonier, you brought this up earlier, and I think when people, instead of first off just saying what's wrong with you, you know, learning what are the right questions to ask someone who's struggling, and then as people present, it's giving people very specific skills on how to listen, actively listen rather than judge, and help identify what to do in case of a number of different circumstances that present when someone is struggling with a behavioral health issue. And so it gives practical tools for people who are not mental health professionals. And in fact, you know, there are organizations that are training. Starbucks now, for example, is training up a lot of their staff because they're seeing both their employees and people showing up at Starbucks. You know, there are large swaths of people being trained in this who have no interest in being a mental health professional, but much interest in their employees and the people that they care about. Librarians, we've done a lot of work with librarians, police officers, people that experience people that are struggling with trauma and a range of mental health issues every day. And that training now can be done online. During COVID, I think it was all in person, but it is an enormously valuable tool, and some employers are training staff as trainers so they can train all of their employees. So there's lots of important ways to spread this work. But even if you're not ready for that, there's some there's trainings that you can do around mental health awareness and how to access care that my organization and many others do to support people. But
yeah, and it's not training you to be a mental health counselor. I think it's also training you to know just enough to how to handle the situation and pass it along to the right professional. Just because you were a good camp counselor doesn't mean that you're really set to be a mental health professional. And I think it's knowing enough to be able to direct someone to get some real help if they need it there, and to be warm and inviting. So I think it's such a great training for any organization.
Well, Jeff, I'm glad you said that if you're not ready, because even in this, we got to the same way we treat people, that we provide services for. We cannot have that one size fit all. That's right. We have to be very individualized. And so it's not like, and we like to get these models, and they do work for the most part, but they don't work for everybody because it's so individualized. You know what I mean? So I like what you say. Well, some people not ready for that. We use different things, and you got to be able as a employer to look at different things if you really want to do that. One of the things that my organization does is we actually have a hotline for our staff that we use a third party for, and they can call in anonymously and talk about their issues with us as administration. They can vent their frustration or where they think that we are not where we should be. Or I give you one example. I had one of my providers call the hotline and say, I tell the story of how they call a hotline. They would say, well, every time Tonier comes to the facility, she has no respect for me as a provider. She comes and she acts like she's a celebrity or a star or something, which I'm pretty sure I did. You know what I mean? And she comes in, she interrupts group, and she comes in, and all of our partners, because we don't call people clients or patients, we call them partners because we just partner up with them to help them in their life. So the partners come running to me because I bring gifts, right? So, but it was disrespectful, you know what I mean? But I would not have known, and they did not feel safe enough to bring it up to me. So we create a hotline where they can call and just get out there. So when we did have a meeting, I was able to go and say, hey, this is some of the feedback. Do anybody else feel like that? Everybody's hand went up. And we was able to address it. I was able to apologize and get that thing right. But that's because I'm an administrator that's willing to take those criticism and feedback and make changes immediately to help support my staff.
Tonier, you bring up such a great point. I'm sorry, Jeff. It's just such a valid point, is that, you're going to ask the question, businesses have to be ready for the answer, right? So whether it's anonymous through a hotline, or whether it's a staff survey, or even just going to a trusted leader within the organization and sharing it, staff, senior leadership have to be open to take that criticism and make changes, even if it's one person and not the whole. I do want to address a question in the Q&A. So it's a little long, so give me a second to get through it. So how do you manage work leadership expectations when they say they support your well-being, but don't really allow you any tangible relief? The work deadlines never stop. Yeah, I get that one. Do you take from leave to address your mental health? How can you do that without inpatient care of actually, quote, checking yourself in? And in short, how do you not lose your job in the process of regaining your sanity and health? So from a CEO, I'm going to take it from a CEO perspective. If you have worked for an organization more than 1 year, you have the ability to apply for FMLA, Family Medical Leave Act, and that will secure your position, or has an opportunity to a position within the organization. And that is regardless of, that is for medical status. It could be for mental health status. So you can apply for that through human resources, and that is to protect your position. And that is private between you and HR, and a provider has to fill out the form and so forth. So you do have to have a provider fill out the form. But if there is an opportunity where you feel like you need a mental health break, I encourage anyone to certainly speak with their human resources department to look into what that looks like. Maybe HR is willing to just allow you to take 2 weeks PTO, or change your work hours, right? We encourage that within our organization to make sure you have a work-life balance. What's causing that overwhelming stress? Is it that you're homeschooling your kid and you need, kind of a 2-hour chunk in the middle of the day? So I think it's really important to be having those open communications with HR and your supervisor if you can.
Even with supervision too, Tracy, what's been lost in this pandemic moment is just the ability as a manager to walk around and see your people.
Absolutely.
And stick your head in the office and say, hey, everything okay? And that, I think it's incumbent upon us, and I know it's one of my shortcomings during this, last 6-month period is, I have not spent enough time with that one-on-one with people who I would never normally have a one-on-one with, but it's that random head pop in the office moment to say everything okay. And I think supervisors and leadership needs to make a concerted effort to just spend 5 minutes, 10 minutes picking up the phone, shooting an email saying, hey, everything okay? How are you doing? What are you doing to take care of yourself today? It's not going to solve it, but I think it begins to at least open it up that people still are caring for you and looking after you there.
Yeah, asking the question is huge.
Yeah, I think that one of the items is listening, right? Like, and we're kind of touching on that in varying levels, but you have to create the space to listen. And that's really kind of at the core of a lot of what we're talking about is if you spend the time to listen, then you have the opportunity to look for a more meaningful solution to what's going on with your employees and your staff. And it's hard to set aside time, right? Like I call it Zoom stacking. We all have our names, right?
It's a great phrase. Yeah.
You're 1 minute late to the next meeting because you're just getting off another Zoom. And that just keeps going on, particularly if you're teleworking. And it's really hard to find time to be able to check in with your staff, to do what you would do at the end of a meeting, which is hang around for a few minutes and chat with folks, right? Mm-hmm. Or to have built-in travel time so you can go early and see how people are doing. A lot of those things are just gone. They don't exist anymore. So from a leadership perspective, you have to build out the time, but also from an employee perspective, sometimes your managers might not realize. And so, ideally you can say, hey, I'd love to check in with you. And certainly doesn't hurt to try that, right? Maybe it doesn't work, and that's a separate story. But oftentimes people are more than happy to, I think, to say, yeah, sure, let's make some time. Because leaders also recognize that this is not normal, right? They may not have the tools to figure it out, or they may not have the time to figure it out, but I think they're generally more willing to try to figure it out if somebody's coming to them with an issue. So I think that speaking up on both sides, and particularly listening when you're in a leadership position, is really critical during this time, more than you would have before.
It's a great phrase about Zoom stacking because it became such a convenience. Go ahead, Jeff.
Please finish.
No, right. It became such a convenience in the early part of this that I can get another meeting in because I could just Zoom stack it. But I think that the compounding of it is just useless. And I think part of it is making sure, if you're not going into the office, how do you replace that commute at least with doing something for yourself, not with another meeting, but that morning walk, that morning jog, that morning bike ride, and yoga. I mean, doing something to be able to break that monotony. We shouldn't be filling the space with more work, but taking the natural break that you would take a half hour to go from meeting A to meeting B. It's a great observation there, about Zoom stacking. Jeff.
So some basic meat and potato techniques that we're trying, to some successful, some not. Don't make a meeting go for a full hour. Okay. Mm-hmm. We're somehow conditioned to make these meetings, if you have a scheduled hour, stop it at 45 minutes and just stop. I guarantee you people can be as productive in 45 minutes as they can in 60. The second thing that's really important to do, and actually I'm trying it out, again, it sort of works, but actually schedule even Zoom loose time, open time that is not scheduled for an activity, but allows people to just stop by virtually and check in with you. Do that. And then the second is that really insist, set some cultures around responses to emails, text messages, unless it's urgent, to just give people that space. But I think the question, Tracy, that was brought up is pretty significant. Someone is concerned about their overall, needing that assistance and getting their employer to support that. I think Nilesh's point about listening, but as employers and supervisors and people that aren't in our field, is being vulnerable enough to talk about this is hard, and starting a meeting just before you jump right into business and say, look guys, sucks. How are we doing? Let's spend, what's going on with your families, or how are you handling this? This is what I'm doing and what's working for me, and this is what's not working for me. I think truly the success of a leader is if they're vulnerable. And I think part of this is helping employers say, look, I'm not sleeping well, I'm not doing the right things for myself, and here's what I'm trying to do to get past it. Anybody else have some great ideas here that we can use that's working for you? It gets people to talk about this, and again, extends this culture of self-care a little bit more than we've been able to do in this environment. I think asking the question, being vulnerable, and supporting as a business leader, saying, this is a weird, unnatural time that we're in. How are you doing with it? What's working for you?
Also, for me, the fact is none of my staff really want me involved in anything. And I get that, and I let them have that. I'm not going to be an employee say, well, I'm setting this up for you to feel safe. No, I want you guys to, it's your village. It's your village. You know what I mean? And we don't need a whole bunch of, we don't need a whole bunch of chief. I don't need to come in on, I'm not a part of the daily operations. I'm signing checks. I'm traveling. I'm doing this. And they don't want this CEOs and COOs and all of these people because their knowledge is this. They sit in a big office making the big money, right? We down here sweating and getting spit on and getting threatened. So what make me feel safe is you not being right here with me right now. You know what I mean? And we have to learn that, to let them, same way we want to take the lead of those that we provide service for, we need to take the lead of those that provide the services. This is their village, and we want to step back so they can create their own village. And one of the things that we got out of it was when it comes down to, we don't want to have to write a whole bunch of paperwork when we have to do the briefing, when somebody needs to, when we have an altercation with one of our partners, we don't want to sit there. We are triggered. We're feeling this, we're feeling that. So guys, what do you want to do? Look, we take care of each other in this organization. So we want to tag each other out when necessary. If she can't go through it, I can tag her out. We tag each other out, and they came up with that. And we let them come up with what they needed, and not so much to say what we want to do for them, for them to feel safe. And I think that that's what we need to do. We need to let people decide what they need and let them be the village. Because we are all right. Everybody on this call is a CEO or something. And you know what I mean? And we have nobody on this call right now that's on the ground. That's like really, really on the ground in the trenches representing that. And I think that's how we miss stuff. Mm-hmm. You know what I mean? I think that's how we miss stuff. And so that's my input. Just really letting them take care of their village. Let them create their village and take care of their villages, and being recognized that they really don't want us all up in it. You know what I mean? Because they don't feel that's safe for us at the end of the day.
And asking the question, what will help you, I think is really important. We had another question that was also really important. I want to make sure we get to it. So what advice do you have for small businesses who have more limited resources for outside counselors, EAP, and struggle to provide the kind of robust healthcare coverage that would allow employees to seek mental health care? So I do know there are a large variety of public mental health services across all either jurisdictional specific or across the state. So I don't know if Jeff and Nilesh want to speak to that one.
So I'll get started by saying I think that there's a number of things you can do to create an environment where you are open to listening to people's concerns, and you know the reality is that a lot of times that listening and understanding are key pieces, or are actually much larger pieces than we might think in terms of addressing the situation. Oftentimes people don't feel heard. They don't feel like their concerns are valid. And I'm not suggesting that is enough, but that's a really great place to start, and to engage people in asking what would help you. That goes a long way towards figuring out what comes next.
Yeah, there's and we'll make sure when we send out the recording and some resources after the call sometime, probably tomorrow, we'll put some resources in there that are either jurisdictional specific or state specific. I mean, they've even gotten to the point where there's a free text to talk to a therapist that is completely free for people that don't really want to talk on the phone to someone, where you can just text back and ask to speak to a therapist and go through some of your frustrations. And sometimes that's easier for people. Jeff?
Yeah, I mean, I think that I want to answer it a little bit differently, which is,
Yes.
If the question is, if you're a small business, what's available, I would first start, if you are providing healthcare benefits to your employees, is to make sure that you're asking the question, well, whoever is your provider, what are the behavioral health services available? What can they come in and provide to your employees? Because I think one of the things we have to start doing more aggressively is holding our payers accountable for providing these resources. And if you have insurance for your employees, ask the question of the people providing that, about what mental health resources are available for people individually. What can they do to come into your business to provide the supports that they need? I think the other resources, there's some very specific resources that you might want to look into. Through the Mental Health Association of Maryland, there's some great tools. I've been involved with them for many years, and I think they're very much focused on mental health of businesses, individuals, communities, and they're not a provider-based organization. They're looking to advocate on behalf of everyone. I think on the individual case too, like in Arundel County, Baltimore County, there are local mental health authorities and tools available. And I'm happy to share some other resources offline if somebody needs them. But I think we need to start, as employers, start holding the people that we're working with accountable for the resources to help our employees. There are also other tools if things become more urgent or crisis. And again, my organization and others can provide that. But if you're paying for resources already, hold them accountable for ensuring that those mental health and addiction and behavioral health resources are available for your employees.
Thank you, Jeff. So we just have a few more minutes. I want to talk about one or two takeaways that you can give the audience, especially from an advocacy perspective. For those that can't stay on the last few minutes, we will be emailing out the recording of this if you want to share it with your team members who couldn't make it today, as well as those resources. So any last takeaways from today? Nilesh, I'm going to start with you.
Thank you. I think the key things that I think I'd like for people to take away is to commit to speaking honestly within their organization about this, about issue of talking about how people are coping, how people are managing, and committing to creating spaces and methods to do that. There's a lot of resources that are available out there to help think through what that looks like, or to deepen your commitment to that. And there isn't a right answer. It's a process, and that process means taking steps and taking next steps. And so I know that you're going to put up some resources, Tracy, and I think that that's going to be key for people to commit to using those moving forward.
Adam, you're 1 to 2
Yeah.
takeaways. Hard for you to
Yep.
put everything in 1 to 2.
No, I think 2 takeaways are. One is I think, and Jeff said it earlier, is that let's start changing the question from what's wrong with you to what's happened to you, and really finding that ways to be more empathetic and invite these conversations. Employees are not going to come up to us and say, hey, I've been a victim of childhood abuse, or my kid's been a victim of abuse here. That it's going to manifest itself because, and we didn't even really get on this. I mean, the work environment, this costs the American workforce billions of dollars a year due to lost worker productivity. And so we need to find ways, encourage ways to be able to make our environments more trauma friendly, because we'll just improve worker productivity. I mean, if we don't care about anything else, then at least if we're caring about our bottom lines as organizations and employees, we'll get more effective employees if we're able to be more responsive to their needs there, and be just as encouraging and welcoming to that disclosure of trauma as we are about having cancer, or about having Alzheimer's, or about having any other ailments that we open ourselves up to, and we say, of course, take the day off. We don't do that with domestic violence or child abuse or drug addictions, and we need to be welcoming that. The other thing is this, and sort of not to put the black cloud over a lot of this, but most of these services that we're talking about today are funded by a federal pot of money called, from the Victims of Crime Act. It comes from the Federal Crime Victims Fund. That fund, over this administration over the last 3 years, I'm trying not to be political on this, has diminished severely. The administration has not put any money, the federal administration has not put any money into the Crime Victims Fund. That fund has now been slashed severely. And in about a year, the entire crime victims system in Maryland and across the United States is going to fall off the cliff. And so a lot of these services that we provide today aren't even going to be available in a year unless there is something significantly done differently there. Money put back into the Crime Victim Fund, and even on our local efforts there. And so we as businesses need to be prepared for this. It's the shameless plug of, you need to be supporting your local, nonprofit trauma-informed centers. Belts are tight, budgets are tight, but organizations like all of us representing on the call today need your support, because we can't do this work to provide the infrastructure without funding, and the funding is going to disappear dramatically in a year unless things change.
Adam, you bring up a good point that leads to a question that was sent to me via email. What has been the status of efforts to boost access to behavioral health services through healthcare plans and coverage benefits? As a consumer, it doesn't feel like we're anywhere near mental health parity. Getting and managing families' behavioral health care needs can be a part-time job. And so for a very long time, there was a big push of parity between behavioral health and mental health services, especially in Maryland. And that has kind of gone behind by the wayside. So Jeff or Nilesh, maybe you want to take that one, but it's been quiet on parity.
I think the battle continues. I think part of it is there's a couple ways to do that. We need to continue to push our payers, the employers themselves. And I go back to the discussion we've had. As an employer, if this isn't the return on investment for these services are really high, and it's up to you to push name the insurer to make these more accessible to your employees. If there's issues around parity, there are resources to push this both legally and financially. But if nobody, as an employer, if you care about your employees, you need to do this. I think the other wider advocacy point around mental health and access to care, it is a driver of overall health. And as we look at what we can do to improve and reduce costs for people across a number of domains, if we're able to provide accessible, quality behavioral health services, people's overall health improves, particularly with people with significant comorbid conditions. But, you know, to answer, the bottom line is that recovery is possible from this. Tonier is a great example, but without these resources and us investing in our employees, we're not going to be farther down this road. So it's a continuous battle.
Yeah, I just want to add one comment to that. You know what? Mental health is part of health. We would never set up a workplace where somebody would get physically injured constantly, right? Like, we would consider that insane, and we wouldn't have a meeting about that. And I think what we're really talking about is setting up workspaces where we don't continuously injure people mentally either, and we take that into consideration and think through it. And I think it's just reflective of our broader push towards, when we're talking about mental health parity, not just in terms of treatment, but in terms of thinking about it from a public health angle of how do we look at prevention and promotion of health.
Thank you. I wanted to, we're almost out of time. I just wanted to take one more minute to thank our sponsors, the Maryland Hospital Association, Asana Consulting, Renee James Healthcare Advisors, Tribridge Partners, the Turk House, and Anago Cleaning Services for their support on this speaker series today. Thank you to all the panelists, Nilesh, Jeff, Adam, Tonier, for sharing your story. Thank you so much. We have one more speaker series, November 12th, on maternal mortality. And some of you may say, well, why is that important from a business perspective? And as the US, as you can imagine, maternal mortality is so high in Maryland as well as the United States, and we need to think about that from a perspective of from our business perspective of keeping our families healthy. So join us on November 12th. We'll be sending out information as well for our last speaker series of 2020. And I want to thank all the participants for joining us today. Have a beautiful fall Tuesday.
Thanks for the opportunity. Yeah,
Thank you,
appreciate it.
Adam. Thank you, everybody, for joining us. Don't forget to ask your staff the question, how are they doing?
Yeah.
Thank you.
Bye, everybody.
Bye.
Thanks, Trace.
Thank you.